Good morning, everyone. This is Katie Novotny calling in from Premier Marketing. I want to thank you for joining us this morning. We are super excited to have our first webinar to kick off Long-Term Care Awareness Month. As you've probably seen on our social media outlets, this week we took the opportunity to introduce ourselves as the Long-Term Care Department. If you haven't seen it, I would welcome you to just go out and learn a little bit more professionally and personally about each and every one of us here in the department. With that said, however, we today are going to talk about some short-term care, which is an LTC solution as well. Today, I am thrilled that we have Tony Clark and Jamie Sarno of AETNA here to go through the two most common products that you will hear us discuss from AETNA on their short-term care chassis. So with that, you guys ready to take it away?
We are ready.
Yes.
All righty.
This is Tony Clark, and thanks everybody for joining us this morning. And I just think the long-term care awareness situation is such a big deal, and more people we know need long-term care. And we do know, there's a couple of things that come with the LTC business, and that's sometimes it's hard to qualify for, certain products, and also it can get rather expensive at times. So we hope that you'll have a good takeaway from our short-term care products. We really feel like these are state-of-the-art products. Jamie Sarno is going to be discussing and sharing a little insight. He was a very involved, let's just put it that way, person. He's an agent, but he was really involved with helping us create these products. And he's been selling these. He's been doing this for quite some time. I don't want to steal all of his thunder necessarily, but I'm glad to have him on and just have him share his perspective on how these short-term care products can fit in your day-to-day sales as you're talking to your clients. So without further ado, Jamie, why don't you go ahead and take it?
Hey, thank you. I appreciate that. Yeah, no, you're not stealing any thunder at all. Just very quickly, just so you know, Tony and I are both old long-term care agents, so we're excited to be able to talk to all of you today about the AETNA product. So we're going to jump right in here. And first of all, this is probably just one of the things I want to make sure all of you know is out there, especially with COVID. We're using the Medicare New Book 2021 quite a bit with our webinar meetings, as far as Zoom meetings with clients, or just even over the phone. We'll tell them, hey, can you go get your Medicare New 2021 book? They'll go and get that, and we'll say, turn to page 28. Am I an inpatient or outpatient? We know the observation status has been going on now for years, and it's big. You all know this, but this is one of the main causes of people going into a nursing facility, a rehab center, and not getting their bill paid by traditional Medicare. So it's important to know that. And we all know that most of the long-term care plans that are out there have a 90-day to 100-day elimination period, so that's not even there for them. So observation stays knowing it, telling them where to look in their own book when you cannot be with them face-to-face. Next best thing is that they're reading along with you in their own book that has their name printed on the back of it. So remember, it's page 28. It's the same page that it was for last year by coincidence. But it says you're an outpatient if you're getting observation services. Even if you spend the night in a hospital, it doesn't mean that you're an inpatient. So if you're under observation more than 24 hours, you must get a Medicare outpatient observation notice. They call it the MOON notice. And this will say, hey, you're not an inpatient in our hospital. Therefore, when you leave, you might be in here 3 midnights, but you're not an inpatient. When you leave and go into the skilled nursing, Medicare will not pay day 1 through day 20. So very important to know this. It has helped agents throughout the country selling these products to know this page and to help their soon-to-be clients follow along. Medicare only covers these services after a 3-day minimum medically necessary inpatient hospital stay. So it's got everything you need right there to show them in writing. Now, I just made this slide minutes before we came on. There's 101 long-term care statistics, data, facts updated for 2020. I just grabbed a handful that I thought were interesting. You all know this one. 70% of adults who are 65 years of age or older are going to need some level of long-term care throughout the rest of their life. So remember, long-term care is really long-term care services and support. It doesn't mean long-term care insurance. It means nursing home, assisted living, home care, anything and everything, rehabilitation, whatever that may be, it means. 5.8 million, the number of Americans currently living with Alzheimer's disease or dementia. You have a lot of people where this is hereditary. It does run.
Hey, Tony.
Yes.
Sorry, I don't mean to interrupt, but can you reset your slides? Everyone's sending me messages just saying all they can see is Aetna.
Oh.
The first slide.
The first slide. Let's see.
There we go. I see where you are now, but
you know what?
Everybody can just see Aetna.
Yeah. Apparently, when I put it into play mode, it's not working well. So I won't put it in play mode. What we'll do is we'll just click on each one here. So you're going to see my slides on the side. Yeah. Thank you for letting me know. I'm here for you guys. You've got over 8 million, the number of people who receive long-term care from all sources. You have 1.383 million, the number of people who receive long-term care in nursing homes. 68% probability of an individual who is 65 or older becoming physically or cognitively impaired. These are all high numbers. And I know I don't have to sell you on the need, but it is good to kind of remind ourselves that this you can access on the web just like I did. Every 65 seconds, the rate at which new patients are diagnosed with dementia and Alzheimer's disease in the United States. That's pretty scary. And 85 years, average life expectancy in the United States. So, with long-term care, I know a lot of you, I talk to a lot of long-term care agents. Those are my people. And we always talk about what's the sweet spot for long-term care. And, it's anywhere from 50 to 55, 60. A lot of people listen to Dave Ramsey. When Dave says, hey, you should start looking at long-term care at age 60, everyone is looking for it. So that seems to be a popular age too. But the need keeps increasing, even though our long-term care carriers have dwindled down to almost nothing. And to be honest, there's not too many. Even if there were a whole array of long-term care carriers out there, it got to where it was very hard for underwriting. Most people weren't going to be. At least half of your clients would not be issued. Age is a factor. Health is a factor. Premium increases, a big factor in what happened to long-term care. And I will say this. When these plans were built, Aetna wanted to do a very good job at this and not make it like long-term care, but I will tell you this, these plans, these short-term care plans that you'll be talking about with other carriers, I think what you'll find is Aetna Senior Supplemental has the closest thing to a long-term care plan that's not long-term care. So let's get into that. What there are, yes, there's underwriting. There's a yes-no application, and I'm going to show you that here shortly. But along with that application, if they can answer everything no, that's a good application, right? Because a yes answer is going to disqualify them. They do have a backup underwriting to that. Not only do they answer the yes-no, but there's what they call a quick view underwriting drug list. Now, the reason that they have that is so when you're with a client, speaking to a client or an individual wanting this plan, we want to make sure that if you've got a plan that's going to be issued or not when you're with them, because that's the best time to find out, is this policy going to be issued or is it going to be declined? because you can control the moment with your client. It's very easy for all of you to pivot to another product with Aetna, hopefully, or with another carrier. And the main thing is that you help them and you earn a living. So the Quick View Underwriting Drug List is there for all of you to just look, do a quick scan. They're alphabetical. And what you'll do is you'll just look to see, okay, is that medication for Parkinson's? Or is it just high blood pressure medication? It will tell you if that's an acceptable drug or not to be able to get this policy issued. There is no underwriting phone interview, so you're not going to have to put up with doing any type of phone call, three-way calling, whatever it may be. No medical records are required to issue this plan. All they're going to do, they're going to take the application, and they're going to make sure that everything was answered no, and in the background, they're going to do an RX check. So they will know what medications that they've been taking over the past 5 years. So whatever it may be, most of our questions, well, all of the questions on recovery care only go back 36 months. So the medications that they've been taking or prescribed over the past 36 months is really all Aetna is going to be concerned with. And that's good for you to know because, like I said, if they're not going to be issued, you want to know right then and there. And that's okay. No hospital stay required to use the plan, and you're going to see it's ADLs or cognitive impairment. E-app available with personal security questions, especially during COVID. Right now, all you need to get the applicant's signature with Aetna is you can ask them a personal security question, and their answer is going to be their signature. For instance, what is your mother's maiden name? They may say Johnston. Okay, Johnston. You get to type it in on the e-app, hit enter. It signs everything for the insured. There's no voice signature, no e-signature. It's done with that phrase. Please look at it. It makes doing business with Aetna so easy because it makes your life easier and their life easier. Renewal premiums do not increase because of age or health changes. So this is pretty big. I will tell you this. You'll never see a premium increase because they have a birthday. And for other carriers, remember, they have those age bands, maybe 65 to 69, it's one premium. When they have their 70th birthday, whether they've used the policy or not, they have a rate increase. And then another 5 years, they have another rate increase. That is the time you're going to find your insureds looking at each other, spouses saying, honey, do we need this? We haven't used it in 5 years, and it's going up. No, we don't need it. And they drop it. With Aetna, you're never going to see that. The only way that they can have a rate increase is if they raise everyone in that state, and they have to have it approved by the DOI. Now, in saying that, Continental Life Aetna has had short-term care plans since 1996. They have never had a rate increase on any existing policy. So the track record means everything, and that gets to the last point on the right. Trusted household name. Aetna means stability, trust. Really selling that name. I think we're the top in the market with a name that's recognizable. So there you go. Now let's get into, go over here to my slides. Here we go. Issue ages, 50 to 89 years old. No gender-based rates. So male, female are the same. And no height and weight chart. That's huge. There is also hospital coverage that's offered within this plan. It's part of the base plan, so it at least comes with $10 a day. And you can choose anywhere from $10 to $300 per day of hospitalization, although most agents don't add that. It was filed that way, so it has to have at least $10 a day. And when you're using the e-app, it automatically throws it in there, which is not a big deal. It's there if you need it or if you don't. Pays in addition to any other insurance. Now, let's make sure. There are a lot of carriers out there that they'll say a couple of things. We pay up to a certain amount per day, or It's a coordination of benefits with their existing coverage. You will not find any of that wording in this plan. It will pay in addition to any other insurance. If Medicare pays the entire bill, we're still going to pay it. If they have other insurance that pays the entire bill, we're still going to pay it. And we're going to pay the full amount that they purchased. So what you have here is any licensed nursing facility. It does not have to be approved by Medicare, does not have to be approved by Aetna, other than it has to be licensed as a nursing facility. So any nursing home. So it will pay anywhere from $10 up to $300 a day. I just said up to. It will pay $10 to $300 per day. So whatever they choose, if the nursing home is charging $250 a day and your client bought from Aetna $300 a day, the entire $300 is going to be paid. And it will be paid directly to the insured unless they assign it to the nursing facility. So that money is theirs to spend as they wish, and there is no 1099 that the insured is going to receive. This is non-taxable. This is not a tax-qualified plan, but it is not taxable. So in saying that, also with that benefit, you get the assisted living at no extra charge. So you can go to any nursing home, any assisted living. You want to go to those 5-star assisted living facilities that are very expensive, you can go. You have up to $300 a day. And I said it again. Choose 90 days, 180 days, or 270 days, up to 360 days of benefit. You can choose any of those to fit their budget or whatever benefit that they would like. And you can choose a waiting period. Notice they don't call it an elimination period because they didn't want it to sound like long-term care, but it's the same thing. It's a waiting period. So you can have a 0 wait, a 20-day wait, or a 100-day wait. And I would say 95% of the policies sold have a 0 waiting period. You want it to cover first day. That will take care of that observation status that's going on right now, especially with Medicare recipients. So how many times can you use this? Does it have a restoration of benefits? Yes, but it's not called a restoration of benefits. Here's the way that they say that. You can use your benefit that you choose, 90, 180, 270, or 360, twice in a lifetime, provided that it's separated by 6 months where you did not need care or receive care. So for instance, if I have a 360-day plan, I use all that benefit. I can use a month here, 3 months there, 9 months here. Once I use all that up, do I get to use it again? Yes. Separate it by 6 months. You hit the triggers again of 2 ADLs or cognitive impairment. You got another year on there. Now, that's all great. So you've got you've definitely got up to a year, maybe 2 years of benefit there. Now we go down to the very bottom of this brochure. It says home care rider. You can choose, this is a weekly benefit. It's $150 per week, up to $1,200 per week. You have the choice of 13, 26, or 52 weeks of benefit. Now here's the interesting thing. This is totally separate from the above benefit. So if you add a 52-week home care rider to a 360-day nursing home assisted living plan, you have 2 years of uninterrupted care. You could use home care, either one, first or second, but let's give a scenario. They go into, or they're using the home health care, they use it for a full year, they know their benefits running out, they still qualify because of 2 ADLs or cognitive impairment, they can go straight into a nursing home or assisted living without waiting 6 months. You don't have to wait in between using the benefit. And you can also use the home care rider twice in a lifetime. So you get 2 years above, 2 years below. That's a total of 4 years. Excuse my phone ringing here. So what is good about this home care rider is it will pay any licensed home health care agency. So not only the skilled type of nursing, where it's physical therapy, speech therapy, respiratory therapy, but also what most people need are like, most of you probably heard visiting angels, the non-medical, the custodial type of home health care agencies, where they'll come in and do light housekeeping, fix a meal, just be there with the insured. Maybe they have memory loss and they can't be left alone for the day. That's what this plan does. It's so versatile. You can have any type of care you need in the home, because as long as they're licensed by the state, it's a home health care agency. I need to speed up so we don't get stuck here. Oh, here's and this typically moves, but we always have the client that says, I don't want to go to a nursing home. I want to stay in my own home. And who would blame this person? But here's what you do. Creating a standalone home care plan within the recovery care product. Here's what you do. If nursing home is not what you're shooting for, just choose the minimum nursing home benefit. So you could go $10 per day of nursing facility care and assisted living, pick the lowest benefit period of 90 days, choose a waiting period. Now I'm saying the opposite. Go ahead and give them a 100-day waiting period, because they really don't care about the nursing home benefit. And like I said, there's $10 a day that comes with the hospital indemnity part. Then you can maximize the home care rider at $1,200 per week for 52 weeks. Now it looks and feels like a standalone home health care plan. And you're getting the very best home health care that they can buy. And remember, $1,200 a week for 52 weeks, you got about $65,000 worth of benefit there. And again, it will pay. And I'm going to show you right here. Here's the triggers. At the top, you'll see 2 ADLs. You'll see in the middle there another trigger, cognitive impairment. It can be either one of those. That's going to activate the nursing home assisted living. The same thing activates the home care rider, but there's one extra thing that they have to make sure that they do. Under the home care services, they must receive 3 weekly 1-hour visits on separate days. Now you might think, oh wow, that sounds like a lot to do. No, think about this. For just 3 hours a week of receiving care, they're going to get their full benefit. If they chose $1,200 per week, just those 3 hours, they're going to get $1,200. They can spend that money on anything they like. It's their money. So if they want to hire the neighbor to come and sit, if they want to hire the granddaughter, they want to use it to pay for mowing the grass, it's their money. They can use it for anything. And it just takes 3 hours weekly to do it. Now, show you this. This is rates at a glance. I chose a 65-year-old, first day coverage, no waiting period, no hospitalization required, skilled intermediate custodial, and assisted living. Now, if you look at this, you'll see I just chose a 90-day benefit because I wanted you to see how inexpensive, if you run across someone that says, well, I don't have a lot of money to spend, number one, they may not need the plan. But let's just say you're easing them into the product. Maybe they had Medicare Advantage and they're not used to paying premiums. Look at how inexpensive this is. $100 a day for 90 days, $16 and change. $200 a day is $18,000 in benefits for 90 days, $31.69. $300 a day for 90 days, $27,000, only $46. Now, here's more realistic of what we see on this plan. $100 a day for 360 days, I'm going to call that a year. $36,000, only $42.94. $200 a day, $72,000 in benefit, $84.11. And $300 a day maxed out for 360 days is a whopping $108,000 that they could potentially use twice, is only $125.27 monthly, or $1,500 a year. Very inexpensive. That's why I say nothing like long-term care when it comes to premium, when it comes to rate increases, because there have been none. And let's see how much time I've got.
Hey, Tony. Tony, or I'm sorry, Jamie.
Yes. Yeah.
We have a question in here that says, why would you do this product over just writing home care or home health care only?
Are you asking the Home Care Plus that we have,
So,
writing
home,
that plan?
home care plus, yes.
Well, that's a great question, and I was definitely coming to that because I'm going to briefly skim over that too. But here's the difference. With Home Care Plus, it's totally different on what type of home health care it pays. Home Care Plus doesn't have the ADLs as a trigger. What it goes off of is medically necessary home health care. So it has to be, those 3 visits have to be like a therapy visit, physical therapy, speech therapy, respiratory therapy. It cannot be we're talking about the other plan, Home Care Plus, it cannot be a custodial visit. See, on recovery care, if they're healthy enough to get the recovery care home care rider, you want all of your clients to have that because it has less limitations on the help coming in. With this plan, you can have any home health care agency. On Home Care Plus, it must be a skilled nursing facility. So I'll go over that so you can see it, but hopefully that answered that. And I just want you to see, don't be afraid of this application. Here, I want you to see a quick view of it. It only goes back 36 months, and here's what it asks. Currently, hospitalized, bedridden, receiving home health care. In the past 36 months, have you had chronic heart failure, congestive heart failure, internal cancer, Alzheimer's, or AIDS? Last 24 months, oxygen use, stroke, hospitalized 3 or more times. That means you could be in the hospital twice in the past 2 years, still get this. Do you have diabetes? As long as you don't have 50 units daily or more, you can get this. If you're under 50 units, you got it. And then in the past 12 months, have you had any seizures? Do you have any pending treatment, test, or surgery? That's really it. It's very easy to get this plan. Here's what the footprint looks like for recovery care right now. A lot of these states, as you know, they do not allow short-term care. They have long-term care, but not short-term. We're hoping that changes over the next couple of years, but we'll see. Now, I'm changing plans now. Home Care Plus is the plan that we were just asked about. It is a standalone home health care plan, and here's where this plan shines. So why do we have a standalone home care plan if the recovery care has a better rider? Well, here's why. It's all about the underwriting. You're going to see the same features, no height and weight chart. There is a drug list, but it's different. Each plan has its own drug list. No underwriting phone interview, no medical records, has the e-app with the security question. Premiums have never increased on this plan either. No hospital stay. But here's where it shines. When they cannot get recovery care, okay, and your client has one of these are all acceptable health conditions with our underwriting department. If they have Alzheimer's, seizure disorder, cane or walker use, Parkinson's, heart attack, stroke over 12 months, cancer-free over 12 months, if they currently have oxygen use, connective tissue disorder, which is rheumatoid arthritis, diabetes with no insulin limit, so whatever their insulin limit is, it's acceptable, dementia, macular degeneration. Now, as an agent, I say, how in the world can Aetna sell this plan and take on these people? Here's why. Because what they're not going to pay for the day-to-day care of an Alzheimer's patient, a Parkinson's patient. They're not going to send nurses in there just to sit with them for the day. It doesn't pay for that type of care. The trigger is this. How do I get paid the $1,200 per week? Now, here's what they're doing. It has to be medically necessary. ADL's cognitive impairment does not trigger the benefit. If their doctor says, yes, they need a nursing facility, a skilled nurse to come in and perform the treatment, like a therapy treatment, medically necessary, physical, speech, intravenous therapy, antibiotics, wound care, those type of things. Just 3 visits per week triggers the benefit. So what I tell all the agents, what I tell my clients is this: if you run into someone that cannot get recovery care, home care, rider, you want them to have this. And they might ask you, well, will this pay for visiting angels? No, it will not. But here's what you can do. Medicare, even the Medicare visits, Medicare typically comes out for about an hour every other day. So that would be 2 to 3 times per week. You can use those visits, file the claim under this plan with those free visits for Medicare. Aetna is going to pay $1,200 to the insured. They can spend that money on the care the plan doesn't pay for. Now, that may be confusing. Just please send me a message right now and we'll answer it. This also has a couple of riders. It has a lump sum cancer rider, an ambulance.
Jamie.
Yeah, I think we lost him there.
I think we did too. We lost some sound there.
He's still moving the presentation around. Jamie, can you hear us? Let me see if I can get a hold of him real quick here. If he.
Well, actually, as they're trying to get back on, I'm going to answer a couple of these questions.
Perfect. Thanks, Kate. He's going to dial back in. He didn't realize that we lost him. So, yeah, so go ahead.
Great. Not a problem. Not a problem. One question was, is Home Care Plus available in Pennsylvania? Yes. There are a couple states off the top of my head, and I will send out an availability chart. However, I do know that Pennsylvania and Kentucky specifically are going to have unique products. Some of them do not have the newer products. They still have the older ones. Nothing wrong with them. It's just we do have a difference in availability depending on where the client resides. So I will definitely include the state availability chart, which will include not only the Aetna short-term care, but all short-term care products offered through Premier. Another one is it considered a hospital plan? Are you on? Oh, great.
Tony, I apologize.
Not a worry. Not a worry. If you just want to continue, then we've got a couple questions as we go.
Sure. I don't know where you lost me, but you can see the application only has a handful of questions, only goes back 12 months. And that's really about it. There's our footprint, as you can see, and I'll leave it right there. So let's answer your questions.
Okay. One is this considered a hospital plan?
Well, there is a hospital indemnity built into both of these. Back, the previous versions of these were filed as hospital indemnities, and they kind of kept that same template. So That's why you have to add at least $10 of hospitalization to these. But they are short-term care plans, short-term nursing home, home health care plans. They're not hospital indemnities, but they do have those features.
Okay. And another one is going to be, can you explain how Medicare would cover any of these services, or what they would or would not cover? So basically compare the
Sure.
coverage between Medicare and what this product would, why it's such a nice supplement.
Okay, I got you. Thank you. Another great question. You know, with Medicare, you read anything that talks about Medicare, whether it be a Medicare supplement, outline of coverage, or anything with Medicare, it says pays 100%. And it's always been misleading to everyone, even the consumer, that it's 100% of what they approve. So what they approve, totally different than what they would approve in our mind. So with a doctor's order, Medicare will pay, if it's medically necessary, for about, it's what they call intermittent care. Intermittent, we all know what intermittent means. So it's about, what it averages out to is about an hour every other day. And Medicare will pay as long as the patient is showing that they're getting better, they're improving, and then they'll stop, which takes, 2 or 3 weeks. Or if they're not showing any improvement, that care stops. So basically the 3 visits on separate days are actual skilled visits. Medicare will not pay for a custodial home health care agency. It's always going to be a skilled visit with Medicare. So under Home Care Plus, those visits would count as a visit, because all we're looking for is the doctor says it's medically necessary. That's check marked because Medicare wouldn't be there. Number 2, did they see someone for at least an hour 3 times during the week on separate days? Yes. We're going to pay off that, whether Medicare paid it or not. Medicare doesn't even have to be involved for this to pay, as long as their doctor knows. And I promote this. Tell your client, or typically we're talking to the kids when they call us, say, Mom went into the hospital. Let their doctor know they need to make a doctor's plan of care that says medically necessary, 3 visits on separate days for at least an hour. And let the doctor know it doesn't matter if Medicare would approve it or not. We're not really worried about if Medicare would approve it. We just need that to be done to get paid on this plan. So I hope I didn't confuse you. That was a lot of information.
No, I think this is great. I think we are caught up on questions. So do we have a couple more slides?
Yeah, very quickly, I'll show you this. It's so easy. If you go to AETNAseniorproducts.com and you log in with your agent number, what you're going to do, go to products, and you'll see right here, drug list. Click on that. You're going to go to a screen that looks like this. And you'll see all of Aetna Senior Supplemental's plans. Every plan that they have, from Medicare Supplement, DVH, cancer, everything. Click on the one you want. You'll see this one right here. It says Hospital Indemnity Flex. Just pretend I'm clicking over here. Home Care Plus, Recovery Care. You're going to see Home Care underneath there where my mouse is. That's our old Home Care plan. It's available in like 2 states. But what you'll do is, if you click on this download PDF, you're going to see this. Very clean drug list. And this is typically, I open up to these boxes. This looks very confusing, and this is not what I wanted you to see, but we'll go through this. If you look, it says an X indicates that the medication is unacceptable. But I want you to notice something. The yellow box in the middle here, it says a condition listed means it's a dual-use drug. It may have an X next to it, but if it shows, and if you go down to the 4th drug, Actigol, You see the star there, fourth one down, and you see it's for cirrhosis. As long as your applicant is not taking Actigol for cirrhosis, that means there's something else it can be used for. That's an acceptable drug, even though it has an X next to it. So just because you see an X, don't think that they're automatically out. If it has that condition listed right there in the middle, it's a dual-use drug, and they may be eligible after all. So please take your time when looking at this. And like I said, you're going to find other carriers that don't have a drug list, that, yes, they have an easier app, but I'm telling you, please believe me, the Aetna name you'll have less buyer's remorse. You'll have more people holding on to these plans. Our retention is over 90% on these plans. So I urge you, because of no rate increases, the Aetna name, the great coverage, the low premium, it's the best combination. It's the perfect storm to have a plan that will stay with your client, and you will get paid off of this. Again, we're helping the client, but you got to earn a living. That's what all this is about. It's a win-win for everyone. And don't forget, Aetna has been around since the mid-1800s. They paid the very first Medicare benefit. So, like I said, it's a name that everyone knows, and Tony and everyone's here to help you with any questions or problems that you have. So, thank you for listening today.
So I have a couple questions coming in.
Yep.
First off, some people that are asking me about commissions, I actually will reach out to you directly. Either Mandy or I will give you a call shortly on what pays where and how, and for each state, because a generalized number is just not going to, things can change. A couple questions for, first off, triggers. Can you go over the triggers one more time between the two products?
Yes. As you can see here, this is for recovery care, and this is showing, remember, recovery care is the one that has the nursing home, the assisted living with the home care rider, with the rider that is more flexible in that it'll let you have medical and non-medical. That's the home care you really want to have for your healthy applicant. And the triggers are like this. Same for long-term care. As long as they cannot perform at least 2 of the 6 activities of daily living, that's great. That will get their benefits rolling with Aetna. Or they could be cognitively impaired. If they develop Alzheimer's disease, where their cognitive impairment is vast and they need care, they may be able to control or perform all their ADLs, but they're cognitively impaired. That will also activate their plan. And the last thing, and this only has to deal with the home health care, as long as one of those triggers above, and again, I apologize for the phone, on the home care, they must be getting at least 3 visits per week on separate days. That's it, for at least an hour. And that gets the home care paid. So very easy to use the plan. And what I love about this, I love that the 2 plans have different triggers, because you'll typically find half the agents love when the trigger is an ADL. 2 of the ADLs are cognitive impairment. The other half doesn't like that. That's why the home care plan is there. Most agents will like medically necessary as the trigger. So we have 2 plans that gives the best of both worlds. You can pivot to either plan you want. And just remember this, the recovery care home care rider is going to be the best one for your client, because they can have that non-medical custodial, visiting angels, care tenders. Lots of different states and cities have different names for them, but there's a lot of home health care agencies that are licensed that Medicare will not use. The recovery care home care will allow them to come in there and take care of them, and that means a lot to them.
Perfect. We have one question I'm getting from a couple people are any additional training needed? And I can tell you the great thing about short-term care is we don't have, for example, like the certification. So that is a great thing that we do not have that additional. So truly, we have a lot of people that are on this call that are already set up to sell Aetna products, and maybe we just haven't gone down that road. So like I said, Amanda and I will reach out to the majority of you with some additional questions. One other question would be regarding additional state filings. I'm getting a bunch of email or a bunch of messages saying, is it available here or there or there? Do we have any pending state filings for Recovery Care or the Home Care Plus program?
No, what you're going to see here, I've got the grid up here for Recovery Care. For instance, New Mexico, the Recovery Care hasn't been approved there, but we do have our old version of this plan, just called Nursing Facility Care, which pays for a nursing facility, not assisted living, but it pays skilled intermediate custodial care. So there are a couple of states like I said, New Mexico and Pennsylvania have that older plan. So there are plans available there. They're just older plans, and they do not have an e-app, unfortunately. But they do have paper apps. So if you do not see your state listed here, Aetna is constantly trying to get plans that can be approved there. But I will tell you this. Right now, short-term care over the past couple of years has been going under some scrutiny from the NAIC because they want to know, is this like long-term care? And basically, do they need to be afraid of it the way, because they have the experience with long-term care. They know what happened with that. And what they're finding is that they do not have to be afraid of this product because each company knows their limitation. There is a cap. It's not like it's a lifetime benefit. And with inflation riders, you won't see inflation on here, non-forfeiture. You won't see any of those riders, which make a big difference. So the NAIC is still mulling that around, and Aetna sits on the board with them to make sure that on their panel, I should say, on long-term care, short-term care, because they're calling it a couple of names, limited duration long-term care. There's a couple of different names they're kicking around. But even though you don't see the state like California and Florida, oh my gosh, we'd love to have Florida. We really feel that over the next 2 to 3 years, there should be some changes and that they'll be opening up. But there's really no pending states right now. We're trying to get in the states that we can. There are email blasts that come out once a week from Aetna with new launches. So they don't attack you with all these emails all the time from Aetna Senior Supplemental. You'll get one per week, and it will tell you the new launches for each state. So keep an eye on that when you get it. Know that you're not getting it, a bunch of them, and you'll know if we open up a new state.
Perfect. Well, I think we've handled everything. Again, there's a lot of questions on state availability, and I will be sending that out along with the copy of the presentation and some notes that we have, maybe some talking points as well. What we'll do is we'll put something together this afternoon or tomorrow as soon as I get the recording back from our IT department. So again, I want to thank everyone for taking the time to join us today. I think this was a great kickoff. Thank you, Tony and Jamie, for your explanation and going through the product and just clarifying a couple things out for everyone that's willing to take a swing at this product this month.
Well, thank you, Katie. We appreciate being here.
Absolutely. Yes.
Thank you, everyone.
Yeah, thank you all for doing that. And the other thing, Katie, I would add too, if anybody wants to get advantageous, if you do go to our website, the AETNASeniorProducts.com, for those of you that want to check out a product availability chart, it's on the website too. So if anybody wants to just, jump on that after the call or right now, just again, it's AETNASeniorProducts.com, upper right-hand corner. Just log in with your agent. Your typically it's a GNW number, your writing number, and you can have access, and you can actually even download that product availability chart, and you can just look at it, or you can even print it. So just an FYI.
Sounds perfect. I appreciate it, everyone. Thank you. Have a great day. And if you need anything in the meantime, we will be reaching out, but feel free to give us a call here at Premier. We look forward to hearing from everyone. Take care, guys.
Bye-bye.
Bye.